Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome back to the Nourish MD Podcast. My name is Romana Brennan. I am one of your hosts, and today we are joined by Dr. Richard Lee. Dr. Lee is a clinical professor as well as the Cherng Family Director's Chair for the Center for Integrative Oncology at City of Hope. He is also the medical director of the Supportive and Integrative Oncology program at the City of Hope in Orange County. So we're super excited to have Dr. Lee with us here today.
Great. Thank you, Romana. It's great to be here and appreciate the opportunity to be part of Nourish MD.
Of course. We're so grateful for Dr. Lee's time. So just a little background about Dr. Lee. Dr. Lee earned his medical degree at the George Washington University and then pursued a residency in internal medicine at Stanford University. A Fulbright scholarship then brought him to China Medical University in Taiwan, where he learned traditional medicine, focusing specifically on acupuncture. At the University of Chicago, he was a fellow in oncology, hematology, including a stint as chief fellow, and in medical ethics, while also training in clinical research. This was followed by a palliative medicine fellowship at Northwestern University. And currently, Dr. Lee maintains board certifications in medical oncology, hospice and palliative medicine, as well as internal medicine. He has also received multiple awards from the American Society of Clinical Oncology. And prior to joining City of Hope, he was on the faculty at Case Western Reserve University, as well as MD Anderson Cancer Center. So we are so honored to have you with us today, Dr. Lee. Is there anything else you'd like to share with us about yourself or your professional background?
No, I think you've covered it, and I've had a great opportunity to be at many wonderful institutions and learning both from those institutions and patients.
Yeah, wonderful. Well, I would love us to just jump right into this topic of integrative oncology. Why don't you start us out by explaining a little bit more about what is integrative oncology and how does this differ from traditional Western oncology care?
Mm-hmm. Good question about what is integrative oncology. As many patients and colleagues wonder what this really means, and there is often confusion among the terms. When we talk about integrative medicine or integrative oncology, we're really thinking about four major aspects. One is a practice that reaffirms the patient-practitioner relationship. It focuses on a whole person care approach, should be informed by evidence, and lastly, it uses all appropriate therapies, disciplines, providers to achieve optimal health and healing. This is the definition by the Academic Consortium for Integrative Medicine and Health. And then how we apply that approach to cancer care is really what we consider integrative oncology. I think it differs in the sense that from traditional or more standard of care Western cancer approaches, in that it's more holistic and more broad in terms of the types of therapies we'll be thinking about incorporating as part of an evidence-based approach to patients with cancer. And so we'll think about other therapies like mind-body medicine, acupuncture, massage, as informed by clinical research that already exists today.
Fantastic. Thanks for talking us through that. And can you speak more about this mind-body approach to treatment, kind of the philosophy that drives integrative oncology care?
Mm-hmm. Oh, actually, let me back up on the last one. Let me just add a phrase to the definition, if that's okay. In addition, when we think about integrative oncology, we look at it differently than, say, alternative medicine, in the sense that alternative medicine may not have an evidence-based or clinical research to support its use or efficacy and understanding the risk and benefits regarding such an approach. So it's really important and different than alternative approaches where we don't want to use something in place of other standard care approaches or in place of evidence-based approaches. Integrative approaches utilize both standard care Western approaches together with evidence-based integrative approaches as part of a more holistic approach to cancer care.
Fantastic. So it sounds like it's sort of bridging the gap between the two, still having that underlying clinical research basis as the foundation. Would you describe that?
Absolutely.
Okay.
Everything should be grounded in high quality clinical research to really inform patients on what's the best approach for them.
Yeah, which we will absolutely touch on today because I know you're certainly very, very deeply involved in research as well. I would love to dive deeper into the acupuncture aspect. Of course, that is part of your specialty training as well. Can you share more with us about how you actually integrate acupuncture into your practice as a supportive therapy?
So acupuncture does have research to inform about how we can utilize this in an evidence-based way to help patients. There's ongoing data and trials that have shown that acupuncture can help reduce symptoms of nausea and vomiting that often accompany things like chemotherapy or radiation or other treatments. In addition, there's data that indicates that acupuncture can be helpful for different types of pain experienced by patients, including the musculoskeletal pain, in addition to sometimes what we call aromatase-induced arthralgias. Aromatase inhibitors are a special type of hormonal therapy that breast cancer patients commonly utilize, and they can cause these joint aches, which we call arthralgias. And clinical trials have shown that it can also reduce the side effects of these types of medicines on the joint pain. There's other data that it can reduce fatigue, can also reduce hot flashes, and also reduce symptoms of dry mouth or xerostomia due to radiation effects. So there are several symptoms for which there is growing data to consider using acupuncture as part of the adjunctive treatment that patients are undergoing while they're receiving treatment for cancer.
And would you recommend acupuncture for everyone undergoing a variety of different types of cancer treatment, or is acupuncture better suited for particular individuals?
Generally, I don't recommend acupuncture for every specific patient I see, and in large part because I want to make sure that our approaches are tailored to what they're experiencing. And that's what the data indicates to date. It's helpful for some specific symptoms, but not necessarily for every symptom that patients might be experiencing. In addition, we have to think about, are they in active treatment? What other ongoing comorbidities or health issues they might be experiencing, or other side effects? So I think it has to be a really tailored approach for every patient to determine who might best benefit from acupuncture versus some of the other therapies that we might have available, both integrative in nature or more standard of care approaches.
And for that symptom resolution that some of your patients are experiencing from acupuncture, is acupuncture great as an acute treatment method, or does it have to be used more as like a chronic integration into their treatment plan in order to see that symptom resolution?
Acupuncture can be helpful for both acute and chronic symptoms. Oftentimes, patients need to have more than one session. I've had patients who come back and say, "Oh, I tried it once or twice and it didn't seem to help." And that might be the case, but many studies indicate that we need to have more treatments, anywhere from 6 to 12 treatments, to really know if it's going to be helpful or not. Oftentimes, I'll recommend patients for, say, chronic pain symptoms. It's more likely they're going to need more than a couple sessions. So I'll suggest maybe twice a week for 4 to 6 weeks, and then to reassess. If after 10 to 12 treatments, they haven't found any significant improvement, then it may not be helpful for that particular patient. And again, it's very specific to the symptoms. So for some patients, it might be helpful for pain and less helpful for nausea, and vice versa. So every patient responds differently to acupuncture, just like any medication that we might try.
Yeah. And for anyone who might be maybe a little apprehensive or a little fearful when it comes to acupuncture, just, given that we're inserting needles into different areas of the body, can you dispel a little bit of, are there risks to acupuncture? Does it hurt? If you can kind of speak to what someone might experience if they were to do that level of treatment.
So acupuncture, for those who have not tried acupuncture, involves the use of very, very thin needles. The needles are thinner than the needle we would use, say, for a blood draw. And so patients might feel some pressure or dullness at the location, but generally sharp pain is not something that we generally have patients experience while they're getting acupuncture. It may occur if the needles happen to hit a nerve or a vein area. But for most locations, it tends to be maybe even not noticeable that the needle's being inserted into the skin. And so for patients who've never experienced it, I always recommend trying it at least once. Because many patients are pleasantly surprised how relaxed they feel and how much it relieves their symptoms. So it's something to consider for patients who might be experiencing some symptoms.
Fantastic. And can you dive into what other alternative or complementary therapies that you do include into your practice and how you've seen those be effective for your patients?
And here at the Cherng Family Center for Integrative Oncology at City of Hope, we focus on evidence-based therapies that have already been studied in clinical trials. So in addition to acupuncture, we are incorporating things like mind-body medicine, such as yoga or meditation. We're also providing oncology massage for patients to help with pain and relaxation. We recently have started our own expressive arts therapy, focusing on music therapy as another modality to help with patients. We also have myself, physicians, and nurse practitioners who can see patients for consultation to help really provide guidance and answer any questions that they might have about a more holistic or integrative approach to their cancer care.
Fantastic. And can you rattle off some of those additional symptoms that you've noticed these alternative treatments be effective for? Just one more time for those who are listening.
So the symptoms that we commonly utilize integrative approaches here at our Cherng Family Center for Integrative Oncology will be for pain, in which there's data for things like acupuncture, mind-body medicine, massage, reflexology, music therapy. Other symptoms include anxiety and depression, and there's actually high-level evidence based on the clinical trials that mindfulness-based approaches or mind-body medicine can be very effective at treating both anxiety and depression during treatment and into survivorship. Other things that have been shown to be helpful include simple things like lavender aromatherapy, Tai Chi Qigong, yoga, acupuncture, hypnosis can also help treat some of these symptoms. There is data on nausea and vomiting, including things like acupuncture and the use of ginger supplementation can help reduce chemotherapy-induced nausea and vomiting. In regards to fatigue, which is one of the most common symptoms, we'll think about activities such as exercise, mindfulness approaches, yoga, Tai Chi, and there's even some data on the use of ginseng extracts to help with cancer-related fatigue. Other symptoms that patients may experience are neuropathy, which is a numbness and tingling due to damage to the nerves, commonly associated with some certain types of chemotherapy. There's some data on acupuncture, massage helping with this. There's data on insomnia being treated with simple things like melatonin, yoga, or Tai Chi Qigong. And lastly, hot flashes, which is another common side effect some patients will experience, especially with hormonal therapies. We can use things like hypnosis, yoga, and acupuncture as other modalities to reduce these symptoms.
That's so interesting. I appreciate you providing almost like a visual representation of that for our listeners. And are those all treatment options that are available through your department, through your center?
Yes. So we provide all of these types of therapies and provide guidance for patients if they are experiencing some of these types of symptoms. Many of our patients have already tried standard care options through prescription medications and are looking for non-prescription or more holistic approaches. And so they'll often come to our clinic to explore some of these options. I think it's important to know that patients may often need to try a therapy first for, as we mentioned before, for 4 to 6 weeks to see if it's helping. And if it's working, great. If not, then we might try a different approach.
Mm-hmm. How often are you overlapping these different types of therapies? Do you take a less is more approach, more is more approach, given that, risk versus benefits thought process?
We do take more of a less is better approach. We try to simplify patients' regimen, especially if they're on active treatment, because they have so many other appointments and other ongoing treatments that they're receiving. So we try to simplify the routine as much as possible. In addition, we don't want to mix too many therapies, because then we're not sure what might be helping, what isn't helping, or if they have a side effect, which therapy might be causing that side effect. So I think especially during active treatment, we try to keep things as simple and safe as possible.
Looking for expert nutrition advice? PPMA offers one-on-one consultations with a registered dietitian to help you achieve your health goals. Whether you need a personalized meal plan, weight management tips, or guidance on managing a health condition, our dietitian is here to support you every step of the way. Visit privatemds.com to schedule your consultation today.
I would love to learn a little bit more about your research, Dr. Lee. So in June of 2023, there was a review published in the American Society of Clinical Oncology educational book titled Improving Quality of Life During Chemotherapy, Cannabinoids, Cryotherapy, and Scalp Cooling. Fascinating topic and a really fascinating review. Can you share a little bit more about the insight that you and your research team found throughout the process of writing that review?
Yes, so at the annual meeting, we were able to provide a session specifically talking about different modalities to help patients. Uh, my one area of research that we're engaged in is on looking at medical cannabis to help patients. In particular, we have some research that we have sponsored from the National Cancer Institute looking at use of cannabis for the treatment of chemotherapy-induced peripheral neuropathy. We actually plan to have that study opening in the next couple months. There is data that cannabis, medical cannabis in particular, might be helpful for symptoms like nausea, also for appetite. And there's some data that it may help with cancer pain symptoms. So the data is a little bit mixed. So I think we need more high quality research to know how best to utilize things like medical cannabis. And there's some growing data that it might help reduce anxiety and also help with sleep. So these are some of the areas that people are exploring, including our group here, looking at the different ways that cannabis might be helpful for patients as they go through the cancer journey. And there are other approaches to help with things like chemotherapy-induced peripheral neuropathy. They're looking at cooling the hands and feet, using these cooling techniques while they receive chemotherapy as another strategy to reduce the risk of developing this neuropathy, chemotherapy-induced peripheral neuropathy, really numbness and tingling, which can be painful at times for patients as well.
That is so fascinating, and it's wonderful to be at the forefront of that research and to be able to have your insight on that. Very interesting. Definitely something that individuals should stay up to date on if that's something that is interesting to them and potentially part of their treatment plan. It sounds like when it comes to hot and cold type of therapy, we're more so leaning on cold therapy options. Is heat therapy contraindicated for individuals undergoing cancer treatment?
So I don't think there's enough research at this time as it relates to, say, specifically to chemotherapy-induced peripheral neuropathy. I know that certain individuals are interested in different types of heating techniques, maybe infrared or other techniques. So at this time, I don't think there's enough data to really know, to know if how effective it is and also how safe it is.
Any other factors or modalities that you've seen to help improve quality of life as a whole in your patients undergoing treatment, actively undergoing treatment?
Well, I think one of the most underutilized approaches is mind-body medicine, and really incorporating the strong relationship that occurs between both how you feel and how you feel mentally as how you feel physically. And some of the best high-quality data, large randomized controlled trials, exist in this area of using things like meditation or yoga to help with different symptoms. So I highly encourage patients to explore these kind of options. We provide group programs on Tai Chi, Qigong, and yoga and meditation, and a lot of community centers provide these programs. So if patients haven't explored them, I think it's definitely worthwhile learning one of these techniques to help kind of reduce their stress, help them get into a centered state, because we know going through the cancer journey can be very stressful. And so having this tool is something very easy that they can learn and do on their own to reduce symptoms, especially anxiety, and improve their sleep quality. The other key area I think that's underutilized is patients often underestimate the importance of nutrition and exercise as part of their overall holistic approach. And so helping patients as they go through treatment and into survivorship, especially following the American Cancer Society guidelines on nutrition, as well as regular exercise. Studies have shown that patients who exercise, mild to moderate exercise during cancer treatment, actually reduce symptoms of fatigue and reduce symptoms of reduced side effects from the treatment. So I think there's a lot of benefit to these kind of core foundational approaches as part of their holistic care plan while undergoing treatment and into survivorship.
Absolutely. Any new or emerging research that makes you particularly excited for the future of integrative oncology? In addition to the study that you will be opening up in the next couple of months?
Well, I think there's a growing interest in looking at how technology might be able to help implement some of these strategies, whether it's using an app to help patients learn, say, a mind-body technique, or can we use technologies such as virtual reality, augmented reality to help them relax, maybe learn these mind-body techniques or learn other approaches. So I think technology is a key area, and we're starting to explore, as well as others, how we can best utilize these approaches so that we can impact more patients. Oftentimes we tell patients they have to come in for a visit, but maybe they can learn or attend a virtual class on meditation or yoga so they're there at home and don't have to travel back and forth. So I think that's one key area that I'm very interested in seeing more research in.
That's fantastic. And of course, making that information more accessible to more people, and also getting people more familiar with the concept of integrative oncology. I think that's a fantastic way to help bridge that gap. Some additional research that you've been involved in does pertain to some of these alternative treatments, such as mistletoe therapy, utilizing mushroom extracts. Care to touch on either of those topics and anything else that might fall under a similar category in terms of adjunctive treatment options?
Yeah, so we are actively studying what we consider natural products as a source for new drug discovery. We have active research programs looking at mistletoe extracts as well as mushroom extracts here at City of Hope. What I would caution patients is that although there is research preclinically in the laboratory, in animal studies or in cell culture, that these types of compounds might be helpful, until there is a active clinical trial in patients with cancer, we really won't understand the full extent of the potential benefits as well as the potential risks associated with these types of compounds. And for patients undergoing active treatment, we always have a more cautious approach because some of these compounds have been shown to be potentially toxic to, say, kidney function or liver function, or may interfere with ongoing treatment, such as green tea supplements in high doses can be liver toxic, and they can impact certain types of chemotherapy like bortezomib, which is a therapy commonly used for multiple myeloma. So we definitely need to look at and study these types of compounds, but we should do so in within a clinical trial or research context, so that patients are monitored for safety. And until there's more high quality research, we should be very cautious about their use, especially during active treatment.
Yeah, and equally important to consult with an expert such as yourself, members of your own care team, just because there's a lot out there, and we want to make sure that you are doing so safely if you are going to experiment with any of these treatments. So I think that's very important to emphasize.
Just an additional comment is that oftentimes patients feel that certain vitamins or minerals are probably safe. But what we have found is that there have been clinical trials of things like beta carotene or vitamin E to prevent cancer. And what they showed is that when patients took these in high doses, it actually led to more cancer than it prevented. So oftentimes I'm talking to patients about be very careful about taking vitamins and minerals. And often what we'll do is we'll check a level, like we'll check a vitamin D level. Do you need extra B12 or iron? Because over supplementation may have its own risks. So that's something to keep in mind, that you really need to have a balanced approach when it comes to even supplements and vitamins and minerals.
Yeah, absolutely. I appreciate you mentioning that, and also making sure that your care team is appropriately informed of any current supplements that you might be taking. If you are working with a dietitian who's recommending particular supplements, or if you're working with a doctor who has particular supplements, we want to make sure that every aspect of your care team is informed so that we're not leading to that over supplementation. So absolutely very important fact to stress. Well, Dr. Lee, thank you so much for your time today. For anyone listening who may not be familiar with you or your practice, but who would like to schedule a consultation, learn more about the work that you're doing, where can they learn more?
Please come to City of Hope website, and you can look at the Cherng Family Center for Integrative Oncology. We're happy to see patients. We see a lot of patients who come in with a list of questions of different things they might have read or heard about. And so we're happy to provide an evidence-based approach to help them, have a safe and effective integrative approach to their cancer care.
Yeah, and we will include all that information in the show notes. Well, thank you again, Dr. Lee. It was a pleasure to have you. If you are a PPMA patient currently and would like more information about Dr. Lee or the work that he is doing at City of Hope, please feel free to give us a call. We're more than happy to set up a referral. But otherwise, thanks so much for tuning in, everyone. We will catch you with another episode in a few weeks.
Thank you, Romana. I really appreciate the opportunity.
Thank you.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional